Thank you very much. Hello and good afternoon, good evening, and good morning to those who are joining us from the UK. I'm Sunny Krishnan, and I'm the Regional Health Advisor COVID-19 for Internews. And in the COVID-19 project, Internews works with a whole lot of partners in Asia to deal with rumors and misinformation in the COVID-19 infodemic. So primarily, we work a lot with journalists throughout the region. Today's webinar, COVID-19 and the return of migrant workers, is jointly organized by Internews and Accountability Lab, Nepal. And in terms of returning migrant workers, we'll be looking at returnees from the Middle East and the Gulf states, making their way back to Nepal, India, and Sri Lanka. And we'll also look at how journalists can cover the impacts. There are three areas that we'll be looking at: the socio-economic impact, infection prevention and control, bearing in mind that some of the returning migrant workers have been tested positive for the virus in the countries sending them back home. And then we'll also look at the whole gender dimension of the returning migrant workers. Many of the returning migrant workers are actually female workers who are actually heads of households. So what is the impact, the domestic impact when they come back home and don't have an income and all that? So we'll be looking at that. Before I pass on to my co-host, Ashmita Sharma from Accountability Lab in Nepal, a couple of housekeeping rules here. Firstly, mute your, other than the speaker, please mute your mics, yeah? And if you have questions, if the audience or the participants have questions, use the chat function, okay? Okay, without much ado, I'd like to pass the floor on to my co-host, Ashmita Sharma from Accountability Lab Nepal, and she'll tell basically what Accountability Lab does, and then she'll introduce the first speaker. Thank you very much. On to you, Ashmita.
Thanks, Sonny, and even Internews for co-hosting this webinar on the effect of COVID-19 in migrant returnees. It's actually really great to be here. So talking about Accountability Lab, what it does is, like, we have been working in Nepal from 2014 with the mission for to foster a positive environment, promoting accountability and integrity in public sector, actually providing a strong and long-term support for the leaders who can promote this kind of like values, accountability and integrity values, and even like support collaboration with people who work for open governments. Soon after the earthquake in 2015 in Nepal, so Accountability Lab started a campaign which is known as Civic Action Team. Actually, it was started to close the feedback loop and build the trust between citizens and the power holder in accountability challenges. So the same model that we use in earthquake has been used to solve like critical challenges on foreign level migration, fiscal justice, election, and open government. So based on all our those experience and learnings of like working in critical issues and crisis, so we have started Coronavirus Civic Act campaign to support the government and citizens to actually, like response towards the crisis that's really affecting, the communities to COVID-19. So what we do through your coronavirus civic action campaign is like we collect the rumors, concerns, and questions from the communities across the countries to actually to eliminate the information gap between the government, media, CSO, and citizens. We even provide the public with the facts and ensure a better, understanding of needs regarding COVID-19 and debunk rumors before they do more harm in the community. It's a saying that, rather than a virus, creating a huge, effect, the rumors that, goes fast than the virus is like really harming people. So we also even not only that we not only like debunks the rumors. What we do is like we even follow the fund that that government has been allocating for prevention and control for COVID-19, and also we also like share about the government mechanism to citizens, to the communities. In addition, we are also like bringing the voices and the situation of migrant workers from the ground to influence and support evidence-based decision making for the government. So yeah, that's all about the accountability lab that we have been doing in COVID-19. Later on, maybe Narayan will be share a little bit more about it. So rather than me talking a lot, so I will like to jump into the panel discussion. So yeah, I want to share that again, a reminder that if you have any question regarding, you want to ask for the panelists, then you can just like, put it in like chat box below. So I would like to introduce our first panelist for today's webinar. So who is like Patrick Duigan, who works for Regional Migration Health Advisor of IOM-UN Migration. So Patrick, the floor is yours. Thank you.
Okay, thank you very much. I wonder if I can share my screen for the slides, or I can just talk. Sorry. It says that the sharing is disabled. So thank you very much for having me, and greetings everyone. So just to set the scene a bit, I suppose, in terms of COVID and migrants, there's 5 key elements that five key elements that I'd like to highlight. First of all, that mobility or people moving is inherently linked with this pandemic. From transmission to mitigation and impact to control, right from the outset, our globalized world of people moving is inherently linked with this pandemic and will continue into the future. Secondly, that migrants, refugees, and other vulnerable populations and those on the move are disproportionately affected and impacted by COVID. And we'll go through some examples of that, but as has been highlighted, particularly those who, because of their living or working conditions, because of the conditions under which they have moved or which they're being returned, as well as the conditions they face upon return, can mean that they can be disproportionately affected as well as impacted in terms of the virus itself, but as well as the socio-economic impact. Thirdly, that migrants and refugees must be actively included in COVID response. So it's simply not enough to say that migrants are allowed to be included or they're an afterthought. We are now, we've been saying this for a long time, but the evidence is starting to show that if governments, if partners, if civil society don't actively include migrants, reach out to them, conduct outreach and bring them into COVID prevention and response measures, then not only will the measures to prevent the virus spreading fail, but also we're looking at significant impacts and putting thousands and in fact millions of people in extremely vulnerable situations. Fourthly, addressing mobility and actions at points of entry and border crossings, as well as looking at this issue of returning migrant workers, is going to be a requirement for the reopening of borders, for managing transmission and re-establishing global travel and trade, as well as economic functioning. We, because of the globalized world we have, because of the millions of migrant workers from Asian countries who are in either move within their country, move cross-border, across land borders, or in this specific example, in other regions, in Gulf countries, a lot needs to be done in terms of facilitating the movement of people in a way that is safe and protecting the health and safety of the migrants themselves, of those who are doing the movement, as well as their communities upon return. And finally, the socio-economic impacts on migrants are going to be massive in terms of loss of livelihoods and jobs, in terms of loss of remittances, sending back home to their families, but also the contribution that those remittances have on the national economies at home is going to be extremely significant. And so migrants must be included in social protection mechanisms regardless of where they are. The notion that social protection, social security benefits, economic stimulus packages is only for citizens is simply not sufficient. And so much more needs to be done to include people where they are, not because of the type of documentation, legal status, or citizenship that they have. So just to go into a few of these in a bit more detail, as I mentioned, mobility is inherently linked with this pandemic. Right from the outset of the origin of the virus in Wuhan in China, because of the globalized world we have, within weeks there was cases being confirmed all around the world, and these global travel patterns do link communities of different transmission and will be ongoing into the future. We also have seen the impacts of the pandemic causing migration movements. So the examples from when there was, and this is for several reasons, can be directly because of the virus and cases itself. So in March, when there was a significant rise of cases in Iran, there was large-scale returns of migrants from Iran to Afghanistan, of migrant workers, because of fears of transmission, but as well as because of loss of jobs and livelihoods. Similarly, in the greater Mekong region, when Thailand announced lockdown measures as a way to reduce the risk of virus transmission, over 200,000 migrant workers returned back home to their home countries, again, because of loss of their jobs, loss of their livelihoods, and fears of transmission. But this is driving migration not because of COVID cases, but because of some of the public health measures that were put in place to try and reduce transmission. But along the way, this creates risks for migrants as well. This is at the border crossing between Iran and Afghanistan during those movements. And clearly, there is not physical distancing happening. This can be causing risks of transmission to the migrants themselves. But when they return home, also they're linking areas of high numbers of cases to areas which have less well-prepared health systems, potentially putting communities at risk as well. And similarly, this was the scenes in the hours after the lockdown measures were announced in Bangkok, driving tens of thousands of migrant workers to try and rush back home, but potentially creating a situation of transmission as well, and luckily that did not occur. And we all saw the reports as well, and I'm sure you are aware of in India, after the lockdown measures there, estimates of up to 100 million internal migrants, as well as cross-border migrants from Nepal and other countries having to leave cities, leave their jobs and travel back, defying some of the lockdown measures and in incredibly vulnerable situations, but also at high risk of transmission during this transit scenario. So the second point is that migrants and refugees can be disproportionately affected and impacted by COVID. So because of the living and working conditions of many migrants face, where there are many in cramped and crowded living conditions, they may have limited access to healthcare, they may not be included in prevention messages, there can be a risk of increase in COVID cases amongst this population. One example of this, even in a high resource, high public health setting, is in Singapore, where we see, although for several months Singapore was managing its cases quite well, including imported cases and local transmission, the figures in blue here show COVID cases amongst migrant worker dormitory residents. So these are migrant workers living in dormitory accommodation in cramped and crowded living conditions. And this is even in a place like Singapore, which, as I said, has high resources, high public health approaches, good capacity for testing and treatment. Even in those settings, because of the living and working conditions, because of the existing inequalities and vulnerabilities of this population, we see evidence of an extremely stark difference between migrant workers and other community in terms of COVID cases themselves. Thirdly, we know that migrants and refugees then must be actively included in response. It's simply not enough to be saying that yes, migrants can be included, or yes, migrants can go and they can go to service the same as everyone else. It requires an approach that conducts specific outreach amongst these populations. This is because they may need information about prevention in languages that are not the languages of their host communities. They may not be able to have higher linguistic skills, like reading and linguistic skills, so require audiovisual or interpersonal communication. There may be fears regarding deportation or financial or legal ramifications for accessing testing and treatment. So there really needs to be an active outreach approach to be able to support these populations where they are, to reduce the risk of transmission. And then, as we're discussing today, looking at actions at points of entry, at border crossings, and looking at moving people in a COVID world. It is a long time before we can say we're planning for a post-COVID world. We are facing a COVID world, and we'll be facing this for many months and potentially years to come. And we are faced with a situation where there are millions of migrant workers who are outside of their home countries, potentially facing significant socio-economic vulnerabilities, may have lack of access to healthcare, may be experiencing discrimination, xenophobia, and other types of stigmatization. And there's been efforts to repatriate these. Some of these efforts are from their home countries, of governments organizing repatriation, like we've seen in India, Thailand, and Sri Lanka. Others, there's been the host countries have been organizing repatriation. So recently from Kuwait, there's been some government organized repatriation, but the process around it must be done in a way that is safe for migrants, that protects their health, safe for the people interacting with them, facilitating that movement, and safe for communities of return as well. And so part of this is looking at what is safety along this way. So there's quarantine requirements which have been implemented in multiple different settings, which is a limited period of time where people are observed of if they are coming from an area that's risk of transmission, to help detect if they do have symptoms or do test positive, so that they're able to access care and support and not lead to further community transmission. And the final point is looking at the remittances and the socio-economic impact. 5 out of the top 10 remittance receiving countries are in Asia Pacific. And across the region, last year, over $310 billion was sent home. However, the COVID pandemic could be estimated to reduce remittances for the South Asia region by 22%. So we're not only looking at vulnerability for migrants themselves because of their loss of jobs and loss of livelihoods, impacting their ability to survive and ability to cater for their basic needs. We're also looking at impact on their families back home because of reduce of remittances, and that may be impacting children's schooling. It may be impacting access to healthcare for other family members, but also impacting the economies of these sending countries for their ability to be able to re-stimulate that. So what needs to be done? There are some key steps that we need to do. Firstly, migrants and mobility must be included in national response plans. No government is going to be able to address the COVID pandemic in terms of the virus transmission or mitigate the socio-economic impact without considering the importance of migrants and mobility and how people are moving, as well as the vulnerabilities of those. This is essential that all countries must do this. We need to promote specific migrant outreach and inclusion in all aspects of prevention, testing, treatment, surveillance, and mitigation. This is beyond, as I said, beyond just passive inclusion, and promoting active inclusion to really reach out to these populations where they are, using social media, using different methodologies, and making sure that people are getting the message in the language and the way that they need wherever they are. It's important to also monitor the impacts that the public health measures are having on mobility and the potential mitigation strategies. And this will help for future planning. We saw a widespread, very rapid spread of lockdown measures and shutdown measures which were implemented across the world, which, as we've seen, can cause migration because of those measures. As countries are starting to ease some of these measures, there needs to be a lot better emphasis on monitoring the impacts and considering these impacts, so that if there is a flare-up on cases and localized lockdowns are implemented, that the impact on human movement is anticipated to be able to prepare for that as well in communities of return. It's critically important to address stigma and discrimination all along the migration cycle. So where migrants are in destination countries experiencing stigma and discrimination, but we've also seen and return as well them facing this in their home communities. Migrants must be included within the analysis and the socio-economic response and mitigation strategies. And finally, we're not going back to normal, and even the new normal is not really something that we can be talking about, because the new world that we're talking about is not going to be normal. It's going to be a COVID-19 world, at least for the foreseeable future. COVID has really highlighted some of the existing inequalities that migrants are faced with, and so we need to be building capacity of migrants, of communities, and governments themselves for better managed migration, better respect for human rights in a COVID-19 world. Thank you very much.
Patrick, thank you very much. As a reminder, if you do have question, please submit it in the chat box, and during the Q&A period, we'll be turning those questions to them. So now I would like to introduce Narayan Adhikari, who is a country director of Accountability Lab, Nipah. Narayan, over to you. Thank you.
Thank you, Asmita, and thank you, Sunny, for this wonderful event. Indeed, this is very timely and important issue, which I think Dr. Patrick has nicely presented with all the evidence, how the migrant communities are affecting and what the government should do to have a better response to make their life easy and then everything. So just to echo on that, let me begin with saying that the Accountability Lab works to make governance working for people. So we support active leaders, active citizen, responsible leaders, and accountable institution with the knowledge, network, and communities we have. I'm sure many of you know there's one of our very cool campaign called Integrity Icon, which is a campaign we work to build a sort of positive narratives around public servant, that naming and faming is the only way to combat corruption rather than naming and shaming. We support a lot of young people to build their ideas around accountability using films and arts and theaters, sort of like creating a cohort of new millennials. And then obviously we work with the communities. And while I'm saying working with the communities is really creating an ecosystem around different people, institutions for a collective advocacy. And migration is one of our core areas at the moment where, in Nepal, we have huge migrants, workers, communities, the migrant workers working in the destination countries and their families. So let me give you some snapshots and how was the foreign migrant, foreign labor migration situation before COVID. Is like we have estimated number of about 3 million people working in the Gulf and Malaysia. The number went a little bit down after the blockade in Qatar and all. However, some people are saying that the number is around 4 million people. We've been the 19th largest remittance dependent economy according to World Bank, and our GDP is heavily subsidized by the remittance, which is like 28% of the total GDP. The migrant workers have been facing all kind of problems, and one of them were like they're in the debt trap, and the fraudulent recruitment agencies, irregular payments, and the living condition of the migrant workers. So I have been to some of these Gulf countries in Qatar, and I have seen how the migrant workers are living in the camps. There's a lot of migrant workers putting into a small case with very low, under, it's a very, very soft standard facilities. And I think because of that, the migrant workers today, facing more problems, in terms of, getting infected from each other's, of COVID. And I think even though the migrant workers facing a lot of problems, so the getting justice system was not really there. So the migration process has never become accountable, and people returning with empty-handed, returning with, becoming a victim, we're never getting justice on time and justice, and full justice. But then after this COVID-19 hits, we have seen that one of the largest impact is obviously on declining the remittance. Just before remittance, like 8 months before we used to have around 879 billion rupees, whereas in last 8 months, if you see the data, it has already declined up to 300 million rupees, and and the declining trend is increasing. Sadly, we don't have the recent data, so hopefully we'll get some kind of data of last 3 months, but this clearly shows that our economy is completely depending on the remittance. So the COVID has not just created a situation for infection and other issue, but the major one is losing jobs in destination countries, and they have an estimation that 20 to 25% of the total, the migrant workers working in Malaysia and Qatar, the Gulf countries, have already lose their job, and the rates of losing jobs is increasing. And then there's another issue is that when people lose their job and the country forcing them to return, and there's going to be an influx of migrant workers in Nepal, and so Nepal's public health system is already terrible, and especially after the COVID, all these facilities, including quarantine, isolation, and other treatments, are not really there. So our existing quarantine facilities is already occupied more than 50%, which is mainly because there's a lot of people coming from India, and we have also another issue of the migrant working in India, so they are returning, and there's a open border, so you can imagine the numbers are just increasing day by day. So there's another issue about like the social discrimination around this migrant issue is also seeing sort of prevalent, and they are seeing differently because they think that these people are the carrier of the COVIDs, and also the social status of these people have been maintained by the economy they have generated, and while they are losing jobs and coming back empty-handed, and coming to Nepal and doing nothing, and being jobless would be in problems in terms of social recognition and respect. In this situation, there are a few good steps that we have seen how the government in the destination countries and the government of Nepal has done in favor of migrant workers. You can see there's one of the great steps was that, the amnesty for the migrant workers, those who are in charge of criminal offense and sort of, illegal action. So all these countries like Kuwait, Dubai, and Qatar has given up the criminal charges and requested the Nepali government to take them back. So on the other hand, Nepal government is collecting data about these migrant workers if they would like to come back to Nepal, and there's around 600,000 Nepalese have already registered in our embassies, willing to return to Nepal. Some of the destination countries have also offered free return airfare. So, however, there's not confirmed for everyone, but at least there's a news and some of the decisions we have heard. There's we have lack of. I already mentioned it's quarantine facilities. If we have to bring these people here, and one of the fear for the government now is, though they would like to bring them back after facing a lot of criticism from the citizen here and also globally, but the problem is that where they're going to put that huge number of people, there is no quarantine facilities. And yeah, actually there's a government, Nepali government is also making a frequent conversation with these countries, like the destination countries' government, to make sure that the migrant workers they're safe and they get the full support they need it. However, the destination countries again and again, forcing to our government to take the migrant workers back. So, but the migrant workers in between, is not really getting well treated, and they are even having more difficulties. We have stories of how they're living in the camps with very limited facilities and in such a harsh weather and hot climates. So few steps that the government has recently taken in Nepal in terms of the economy recovery around these migrant workers, especially creating jobs. So recently the government has allocated 11.6 billion rupees to sort of provide employment opportunity for the returnees under the Prime Minister's Employment Fund, which we hope that is a good steps. The government also strongly, put their statement forward that the CSOs and the private sectors should make some arrangement and programs to incorporate migrant workers' skills and talents, after they return home, to really engage them for the economic activities. There's a lot of anti-discriminatory laws and provisions and the mechanism we have which need to implement strongly to protect the rights of the migrant workers and let them live their life with in dignity. And they needed the strong bilateral talk between these destination countries and the Nepal, though they have been having some calls, but there is no really a strong bilateral action that we have seen in protecting these migrant workers in the destination countries. So that is overall the migration situation. So let me also give you how we are doing through our Civic Acts coronavirus campaign. I know Asmita has already mentioned you in the introduction. I think the Civic Acts coronavirus campaign is really the community where of organization and individuals, the government officials, civic tech companies and individuals to really outsource rumors, misinformation, and the facts to really debunk those rumors and misinformation, so that the information that are relevant to migrant workers in terms of getting access to this, access to services, justice, or basic stuff like how to adapt in this situation will get. And it's a large network of CSOs, large network of journalists. So we create a very nice, beautiful infographics, lots of data sets in it in different languages. Also involve migration organization, including the informal and formal migrant workers network spreading around these countries and in Nepal to crowdsource the information, the stories. We also do a lot of the webinars, the radio engagement, social media campaigns, WhatsApp communications to ensure that these information are spread, fast, and the people who are in need will get it on time and will be able to solve the problem. So this is really a collective action for change. Thank you. I'll stop here, and looking forward to hear your feedback and question.
Thank you very much, Narayan, and that was great. Right now, I'll take this opportunity to present, to introduce Dr. Jaya. First, I think, Narayanan, can you stop sharing your screen? Yes, thank you very much. Thank you very much. It's great. Okay, I'd like to introduce Dr. Jaya, my colleague from Internews. Dr. Jaya is based in Chennai, India, and she is Internews pandemic mentor for health journalism in the Asia region. Dr. Jaya has got a background in medicine, and she's also got a background in journalism. She used to work for a couple of papers in South India. I know Dr. Jaya for a long time, and we worked together during the heydays of HIV/AIDS. She was working on AIDS, and I was working on avian influenza. So we had two emergencies. So that's how we got to know each other, and we didn't see each other for a long time, and this emergency has brought us back again. So on to you, Dr. Jaya. Thank you.
Thank you, Sunny, for those very sweet words of introduction. It's a pleasure to be interacting with you again, and it was a very good learning exercise to listen to the excellent thoughts that were shared by Dr. Patrick as well as by Narayan. And I'm not going to share any slides here. I think we're very short on time, so I'm just going to focus on some of the aspects that reporters could think about while discussing issues related to COVID-19 and the return of international migrants back to their homes. Very unusual in these times. And I just wanted to, I wanted to share my thoughts on a few of the articles that are now beginning to appear in the Indian press. I'll read out just one headline, and you can tell me what you think of it. This one says, like India, Nepal, Sri Lanka, and Bangladesh are scrambling to bring back workers from abroad. And the little heading under that says, the returning migrants will increase pressure on the public health sector and the job market. That was one. Another article, just one more example, is another leader. And this article says, Kerala is bracing for a surge in coronavirus disease because of the influx of stranded expatriates from West Asian countries who are being evacuated by the central government. And those stuck in other states are also returning home amid the easing of lockdown restrictions. And the state of Kerala has reported 97 COVID-19 positive cases in the last 5 days, taking the total to 630. This was from a few days ago. Now we're over 900 in Kerala. And there's been a spike in cases when it appeared that Kerala was on the verge of flattening the curve. And the number of COVID-19 positive cases has returned since the influx of Persian Gulf returnees. And then the article goes on to say that the police booked 3 persons in Kollam under the Disaster Management Act on charges of hiding their health condition after they returned to Trivandrum from Abu Dhabi. And the trio tested positive upon their arrival and had telltale symptoms of SARS-CoV-2, which causes the disease even before boarding the flight. And many complaints have surfaced that people suppress their fever by popping paracetamol tablets before boarding flights to escape the thermal scanners. I mean, these are just 2 examples to show that although these are a sort of a bold statement of facts, I can't help thinking that these kinds of headlines and reportage is going to fuel greater fear of the returning migrants, greater distrust. much more suspicion and a lot of finger pointing that, you know, we were on the verge of flattening the curve and now it's all spiking because of these, carriers. And it's, this is just been preceded by other kinds of very, very stigmatizing reporting, which pointed out some people with COVID-19 as being super spreaders. I recollect I was just sharing with Sunny some time ago how there was so much of discussion around why we shouldn't use words like co-transmitters or super spreaders when we were talking about people who were most vulnerable or affected by HIV during the days of the HIV epidemic. Just serves to stigmatize them and promote a sense of otherness. The bottom line is, as far as COVID-19 is concerned, every one of us is vulnerable. Every one of us is affected globally. Every one of us is affected. Some of us are sick with it. Some of us are asymptomatic, but every one of us needs information that is not discriminatory. We don't want to be stigmatized against or set aside. The second major issue that's happening with the reporting in India regarding the return of migrants from the Gulf countries particularly is that the images that we're seeing on television as well as in the media are very, very disempowering images. You know, migrants are portrayed as victims. Yes, they are. Yes, no doubt about it. But the images are so disempowering and so tragic that beyond a point, you know, there may be a sort of fatigue that sets in. And we're seeing comparatively less reporting on what is being done to help these people. We're seeing a lot of what is not being done to help them, but we're not seeing nearly enough stories of how even small efforts, like the ones that Narayan is doing in Nepal, for instance, or that other CSOs in the country are doing to reach out to the returning migrants. We need to see those kinds of positive stories being reported in detail. Let me draw your attention to a recent, very, very good interview by Al Jazeera with the Chief Minister of Kerala, Pinarayi Vijayan, where he details all the disaster relief measures that were instituted in order to welcome what he calls not migrant workers, but guest workers, you know, coming back to his hometown. So he doesn't even want to call the migrant workers, he calls them guests. People from other states in Kerala are known as guest workers. There's a lot of value that Kerala has been attaching, you know, to the terminology that they're using to address migrant workers from other Indian states who are there working in their state, contributing to the infrastructure and to Kerala's economy. So I think Kerala has adopted, you know, 2 or 3 sort of approaches to both discussing the issue as well as implementing measures, both from a socio-economic impact, turning as well as those who have come from other Indian states staying there, who are now being repatriated back to their states. It was among the first states to organize relief camps for them, distribute food and cash, and take care of their health, implement testing, and so on. So, you know, to some, you know, in some ways, it's, yes, it's a left of center approach, but it's really paying in this way. It's been a very, very inclusive sort of approach where the human face of the migrants has never been wiped out really from Kerala's response. The second major aspect to do with reporting around the COVID-19 crisis and the returning migrants in the context of Kerala that I'd like to flag up is we need to see more stories in the media of pandemic preparedness measures that Kerala implemented, you know, thanks to their recent experience with the Nipah virus. We're not nearly seeing enough stories on that. So how did Kerala handle the Nipah virus outbreak last year, mid-2018? And what were the measures that it put in place, and how their health minister has really, you know, used those lessons to build on those lessons and improve them in order to handle the current COVID-19 crisis. They followed the WHO protocols to a T. And to be, you know, again, one more point in their favor has been the years of investment in the social sector in Kerala, primarily in the areas of education and health, and then gender equity. That is really paying off in their response to COVID-19 and earlier to Nipah. So the high degree of literacy that's been, you know, promoted in Kerala has helped the public understand social distancing better. It's a very good article in The Guardian with an interview with Kerala's health minister, and we're not really seeing enough articles of that sort that need to carry these experiences of what is working on the ground. The third kind of stories that we really need to see are, the stories of the economic impact. I think these are very important. We're seeing enough stories of the kind of, how many Keralites or how many NRIs are there in the Gulf and what their remittances were like and how they supported the local economies back home. But we need to see more reporting on the kinds of schemes that are available and how the government is going about implementing them. Again, Kerala, you see much more reporting on the ground in Kerala on several of these welfare schemes, but the other states, we're not seeing nearly as much. So I just want to recap these few thoughts by saying that we need more practically useful examples of how to handle the coming back from the Gulf, and less of disempowering reporting, which promotes the otherness, the victimization or the tragic impact of COVID-19 on migrants. And we need to see much more of focus on public health, about how the fault lines in the public health systems in many of India's states are actually are the cracks through which the migrants are falling today, thanks to the lockdown and thanks to the disorganized kind of travel, kind of disorganized returning, the patterns of returning to their states that's happening right now. So I think we need to see more public health focused stories in terms of pandemic preparedness. We need to see an impetus towards greater investment in public health, using the migrant story as a peg on which to hang that. We need to see less reporting that promotes feeling of otherness of migrants. And we definitely need to see a lot more on what is being done to mitigate the socio-economic impact on migrants and on local economies. So, I'm happy to take questions later, but I think I will stop here, before which I'd just like to add one thing. There's an excellent set of pointers from the IOM on reporting on migration. And one of them says that relation does not equal causation. So on. So migrants are not the cause of all these issues. Yes, they are correlated with a spike in cases for sure, but they are not the cause. The second major thing is in the rush to promote the Kerala model, in a rush to, because there's nothing else that's good happening, reporters will tend to sort of blow up the success story of Kerala and how it's handling the crisis right now. So in the rush to do that, it's very easy to sort of, make a logical jump, saying that, Kerala always had a very good public health structure. Now it's, that's why it was able to flatten the curve. Not so quickly. We actually don't know whether the data that is coming in on the number of infections and the number of deaths in Kerala is actually true. Repeatedly, the Indian media has been portraying Kerala as a state with among the lowest death rates due to COVID-19, but this could very well be a result of undercounting. Just to give you the example from this morning, Safdarjung Hospital in Delhi has suddenly, upped the number of COVID-19 deaths because they added not just the deaths purely because of COVID-19 infection, they also added the deaths due to other comorbidities. So people who came in with underlying lung conditions, or who were already admitted there with a heart condition, or with diabetes, or because of immune suppression due to some other thing. And that got, and then they developed the COVID-19 infection and were brought to hospital, and then they died. So these numbers were being left out of the COVID-19 death registry, and now they have been added, and then the number of deaths has gone up. So I'd just like to draw your attention to a very excellent resource by Rowan Phillip, a data journalist, and he talks about how journalists can go about accessing, COVID-19 death data. He says, go to the crematoriums, go and see if the number of cases coming there are much higher. Do these verbal autopsies. Talk to other demographers and the sources outside the hospitals who are looking at comparison of deaths overall death rates before and after the COVID-19, before and during the COVID-19 crisis. So he, and then look for increase in the death rates in areas which surround the red zones. So are the deaths spiking up there? So these are some tips that he's giving. I'm happy to share that whole article later. Some tips to address this issue of undercounting of COVID-19 deaths. So with these few thoughts, I think I'll stop here, Sunny, and then we could have a discussion later. Thank you.
Thank you very much, Dr. Jaya. Really very good insights from the perspective of a medical doctor, and advice to journalists on how to do verbal autopsies, go to the morgues, and go through the registrar of births and deaths to get figures and try to analyze and see whether there's a sudden spike in deaths, or tips like this. Yeah. All right, our next speaker is Dilrukshi Handunnetti from Sri Lanka. Dilrukshi is a lawyer, a journalist, a researcher, and she has been working for a long time on migration issues. She's also been a newspaper editor. That's how I got to know her. And she comes from Sri Lanka, and she's the CEO of the Center for Investigative Journalists. And there are fissures, there are fault lines in Sri Lanka. It has been there all the time, but has the return of migrant workers exacerbated these fault lines? Has COVID-19, for that matter, exacerbated these fault lines? Dilrukshi will be looking at the gender dimension. I think there's a question in the chat box. Why aren't we addressing the gender dimension? Why aren't we addressing the return of female migrant workers? And now Dilrukshi will address this. Over to you, Dilrukshi, and it's a pleasure having you here. Thank you
so much, Sonny. It's really great to be here and to join this very distinguished panel and to speak to everyone. I guess to do justice to the gender connection to migrant labor is going to take one whole day, so I'm going to come up with a few points. But for those of you who may not really be very familiar with the Sri Lankan situation, I just want to give a quick snapshot about labor migration trends in Sri Lanka and then look at the feminization of the labor workforce in the country. If you take households, for each 11 households in Sri Lanka, you will find one migrant worker, whether it's a blue collar migrant worker or a white collar migrant worker. So that's where we come from. We are a remittance economy, like several as our Nepali colleague said. So we are also a remittance dependent economy. Also, the people's movement towards the GCC countries has a long history. And since 1915, Sri Lankans have been going overseas seeking employment. And 85% of our migrant workers are now working in the GCC countries. Out of that, 32%, out of that, only 14% would be highly skilled. So this leaves the migrant workforce to be quite working at the lower skill level, and therefore naturally considered vulnerable to multiple concerns. Also, this pandemic also makes us think, first the reaction was that it is a public health emergency at a global scale. It isn't, it's about economic, it's about social, it's about, at the very root, we also find individuals and families impacted by the pandemic. So when you look at the Sri Lankan migrant labor force, 60% right now would be, around 60% would be men, 30% would be women, and there is a reason why. Earlier, we used to have the largest population of domestic workers who were essentially female. But there was a shift when there was a spike in Qatar started experiencing this construction boom, and there were more men migrating, but this was a small window. And then with the political fallout, there was less people going to migrating to Qatar. Even then, Sri Lankans really have 4 preferred destinations. That's Qatar, Kuwait, UAE, and Saudi Arabia. So this also, they also bring in a hell of a lot of remittances. So 6.5 billion US dollars, and that's 8% of GDP. And Sri Lanka is small. Our economy is small if you look at the South Asian context, but for the country, for the size of our economy, this is really, really big. And beneath all that, you'd also find the female domestic worker who's really working hard and enriching economically her country. But then I want to just connect to what Jaya said before about the way in which we frame these conversations, that the problems that are innately there when we frame these conversations and talk about women. But I want to just put a small policy framework to this. Sri Lanka in 2008 introduced a national labor migration policy, which is considered rather a good one. And then a very important sub-policy in 2015 on return and reintegration. So people who are returning due to the impact of COVID would be covered by this particular policy. Why I mention this is there are specifics that we would want to look at in the sub-policy on return and reintegration. One is that you have to look at it from a holistic point of reintegration. You're not talking just about somebody returning from the Middle East. You're talking about somebody who has worked, given of himself to enrich the local economy, and who also have a right to return and find good integration possibilities, meaning socio-economic and also healthcare and other psychosocial support systems. So that's that 1.2 of the policy refers to that. And the other thing is about the kind of social security that is available to returnees. So it is in this framework that I would like to share a few points about women who actually contribute so much to the Sri Lankan economy by working in the GCC countries. Historically, there's been no ban on women becoming migrant workers for Sri Lanka, but except in recent years, there was one policy introduction, and that is called the Family Background Report, or FBR, that prevented women with children under 5 years from seeking employment in the Gulf states, because being South Asian, the primary caregivers are women, and then there was no there was no real concept of or the acceptance of sharing the responsibilities of taking care of the young, the old, the sick. So it's the entire burden is passed on to women. So this was one of those negative policy references we have had. This has also, according to civil society groups working at ground level, this has increased irregular and unsafe migration of women who seek employment in the Gulf states. Now I'd fast forwarded to the current situation and the pandemic. Just early this week, 137 returnees from Kuwait, migrant workers, 137 of them, out of that, so 137 returnees, and out of that 127 migrant workers. And if you really have a deeper look at those numbers, this is also the 137 infected persons, and out of that 127 migrant workers returning from Kuwait. And then they were referred to a quarantine center. The Sri Lanka Bureau of Foreign Employment has facilitated the creation of 2 quarantine centers, one in the eastern coast, Trincomalee, and in the central parts in Bandaranagar. So these returnees will be transferred to those centers. One returnee from Kuwait, a 51-year-old woman who supposedly had heart conditions, died. Along with that, I saw this, splurge of courage, and also people saying that, oh my God, the COVID bombs have come. So the fact that stigma stigma has always colored this conversation, cannot be ignored. So I go back to the points that Jaya mentioned, because stigma is one of the reasons that makes reintegration and return really a very difficult thing, particularly for women. I have roots in Sri Lanka's southern province, and what I've seen at the village level, when you talk to people, is that there are two generations of women who have migrated and worked in the Middle East, but they're always culturally looked down upon as people who either fled homes, or people who did not take their parental responsibilities seriously, or people where women with loose values. So there's a lot of stigma they carry. And on top of that, we all know they also work as domestic workers. Most of them, majority of them are domestic workers. And when you work in conditions inside homes, and now because of COVID in isolation, I've also got information that there are some people who are running away, and many of them are women because of the way in which you're confined to households. You're not working in any other space. You're working inside a private home, and that also creates more mental pressures. And the fact that sending out money, the transfers, all those things are very difficult in a situation like this. But we also have something called a Ratavirua program. This is to recognize that these are the heroes serving the country from foreign soil, because the underlying argument is that we recognize it, or we want to recognize the fact that they line our economy. But along with that, I just want to also go back to the policy component. So we also have a COVID fund, and through that, then there is a national COVID fund, and we are supposed to look at vulnerable communities, which doesn't necessarily give particularly any emphasis on the migrant workers who are returning, despite the crucial role they play in our economy. About the women, particularly, there are a couple of issues that came up. The returning, when they return, also, when you're also suspected of having COVID and you move to a quarantine center, or whether you're a returnee worker, you also go to one of the quarantine centers. Nobody thinks about your gender requirements. And I heard from people who are working at the ground level that there was no question of, you have all these other supplies. We did have a robust way, rather a good system of distribution, which became better with time, of groceries and all that. But there was nothing, no package for women. So I think when you look at not just returnees in this context, returnees in any context, you really have to prioritize the gender aspect of looking at returnees, because they would have different psychosocial requirements. They would have very different takes on what kind of labor, possibilities of re-entering the labor market. It's not like you're a welder or somebody who's driving a car. So if you were a domestic worker, what is the labor component to which you can plug yourself in once you come back? And also when you're returning, like the woman who got completely stigmatized and never, there was not even human warmth and kindness when we started looking at her as, oh my God, this Kuwait returnee. And this is exactly what's going to happen if there's going to be an influx of people returning. Our numbers are spiking. We thought we were ahead of the curve and we were doing it right. We have everything working very well at the ground level. And then you have the returnees, and we know many of them are infected. And this brings out two questions. What is the responsibility of not just the home country, but also of the host country? When you're dispatching people to their home countries, to their countries of origin, what about the primary healthcare? The healthcare that is essentially something that should be made available to the migrant workers who are also lining your own economy. They are also working in your space and contributing to your economies as much as to their countries of origin. And I do know there are some good examples in certain countries, but what's the destination country's responsibility towards returnees? And then what about the response of the home countries, and how do we bring them into sufficient healthcare systems, and do we have the infrastructure such as quarantining centers and other support mechanisms, and are they gendered enough? Can we treat women, and how to are we seeing that this as a very important requirement, that women may have different responses and also different physical responses to that? So are we factoring in all that? I also know that there were pregnant returnees, and so then obviously there has to be a gendered way of looking at this, and whatever the mechanisms that we want to introduce to when we are repatriating Sri Lankans who are returning to the country in this huge evacuation backdrop. Are we prepared enough? Are we ready enough to look at their requirements as women who will definitely have different requirements? The next thing is about social security. When you come back and when you are returning to a country that is already economically hit, the losses are enormous. So remittances have dropped in March, which is a high remittance month for Sri Lankans, because the Sinhalese and the Tamils celebrate their National New Year. And then in April, so ahead of that, in March, generally there's higher remittances to the country. This has dropped by something like 14%. And in April, it's down by 32%, which also means this remittance-driven economy is really hit hard. And these returnees are coming back to a country that is already suffering from severe economic implications, just like the rest of the world, rest of the region. Into that, when you come, how do we look at the labor reintegration of men and women? And do we have plans? What are those plans? And how do we cater to these problems? I think it's only the tip of the iceberg that we are seeing right now. A lot more will follow, because we will have to live with COVID. We will also for a long time, and then we will also have to respond. And our policies and our mechanisms at the ground level will also have to respond to this, and also understand that this is okay. This pandemic is bad. It has devastated the whole world, but this is not going to stop here. It's going to happen more, and there will be other similar situations. And my last point is, when you reintegrate, when you talk about safety of returnees, we think about situations of war, we think about contracts coming to an end. We also think about deportees, but do we think about forced returns? People who are coming right now, and look at situations of health emergencies and other possible emergencies, because I think this is the world that we have inherited now. So these are just my brief remarks, Sunny. So I'd like to take any questions in the discussion. Thank you.
Thank you so much, Dilrukshi. And I'd like to call on my good friend from Accountability Lab, Ashmita. Are you around?
Yeah, I'm here.
Okay, good. All right, we have some fantastic questions in the chat box, actually. And thank you, Dilrukshi and Dr. Jaya, Narayan and Jaya, and also Dr. Patrick. And we see commonalities, we see certain themes emerging from the discussion that we're having today. First is Patrick brought out this whole thing of points of entry. Are there adequate facilities, quarantine facilities at the point of entry? And Dr. Jaya pointed out that India, it's a very a dysfunctional public health system in certain sites, that we would find it difficult in trying to accommodate large numbers of people. And then same thing that Dilrukshi brought up. Dilrukshi brought up a very important thing in the post-pandemic era. What are you going to do with these people? A large workforce returning back again. What are the new kinds of jobs that they're going to do, and all that. So I think we'll take the first question, And this is addressed to Patrick of IOM. And yes, this is from Irene Scott in Internews. A quick question to Patrick. Have you seen any examples of governments in the region that have done a good job of communicating with migrants in the languages and formats they prefer? Patrick?
Yep, thanks. So one example, not necessarily in South Asia, but within the Asia region that comes to mind is in Thailand, where there has been some good efforts from the government as well as partners to really focus on reaching out to migrants in the languages that they need and using methodologies that they need, even to the point of setting up a migrant-specific hotline from the government side to be able to answer questions that migrants have about how to access testing or services, where to go and what to do. That's provided in the main migrant languages, Khmer, Lao and Burmese for migrants. So that's quite a good example. Other governments have also been providing sort of multilingual messaging at work sites and at border points as well. I think key to this is understanding really where migrants are getting their information from and whether they're more likely to be listening to the recommendations and advice from the country that they are in, or the recommendations and advice from the country that they are from. And so we also need to think about, whether it's, ministries of health or other organizations reaching out to migrants who may not be in the country where they are at the moment, but reaching out to reach migrants through existing social network measures to reach them in their countries of destination as well. There's a lot of information out there, a lot of messaging. Not all of it is accurate, and so it's really important that only official and verified sources use information. But that means also that those official sources have a responsibility to reach out to people to where they're able to access it.
Okay. Thank you, Patrick. Just a follow-up question from there. Does IOM work with host countries in the repatriation of migrant workers back to their countries?
So no, currently repatriation regarding from COVID is a government initiative. And so to date, IOM has not been involved in COVID-related repatriations. Where there has been some requests from governments to assist, but that's not something that we have been involved with thus far. But we have been involved in helping governments address issues around the point of entry, screening protocols, quarantine facilities, looking at making sure that the protection concerns are taken into consideration, as well as advising on the importance and need to reduce stigma and discrimination has been mentioned several times. I think one interesting point is that the stigma and discrimination regarding COVID cases has been very fluctuating over time in a rapid period of time. If we take the example of China, initially there was fear and stigma of people from Wuhan within other areas of China, and then from Chinese travelers abroad in other countries. But then as the cases came down in China, within China itself, there started to be more stigma and discrimination of non-Chinese citizens, those of African origin or European origin. We've seen that in other countries as well, as depending of what is in the news of the latest hotspot, people who look like that tend to be suffering from stigma and discrimination. And like we see in other sort of illnesses, as a country gets better at managing the illness itself, then because the cases are going down in a country, it necessarily means that the proportion of cases in travelers or overseas populations will be increasing, because if country A is doing a good job at managing the cases, but other countries where people are traveling from or traveling to or coming back from aren't doing such a good job, it necessarily means that the proportion of cases amongst foreigners or travelers will be higher. And so even though the number of cases might not be a lot, there's a lot of reaction to that, as people are bringing this disease people bringing this illness. But again, it's not just migration in itself isn't a health risk, but it's the conditions of the migration, the conditions people find themselves in, their access to healthcare and testing and treatment, but also that these repatriation movements can be made safe, and that's why these quarantine procedures are in place to be able to detect any cases and provide appropriate treatment and isolation so that it doesn't turn into increasing cases in the community.
Thank you very much, Patrick. I think you've answered also Vijay Shankar Balakrishnan's question on giving good examples from the region. I'd like to throw a question to Dr. Jaya, and incidentally, thank you, Jaya, for sharing the resources also to Vijay Shankar, and very useful resources, and how CSOs can also get involved in this issue. I'll direct this question to Dr. Jaya and also Dilrukshi. India and also Sri Lanka have got fissures. They've got fault lines in the whole socio-economic and political systems. You have a fault line of this whole issue of social diversification, the caste issue, which has been on the surface buried and all that, and for a long time maybe. And then you have the issue too of the 1947 partition between Hindus and Muslims and the birth of the Pakistan state. How have these fissures, these fault lines now, have they become exacerbated with COVID-19, and more exacerbated too with the return of migrant workers, and also within the countries, especially in India, with the displacement of workers actually. And you hear stories of workers walking for thousands of kilometers, stories of workers like, going from Bombay, from Maharashtra state, and going on to West Bengal, walking and, in rickshaws and cycling, and with their families and all that. So how has COVID-19 actually exacerbated this problem?
Yeah, thanks, Sunny, for that very important question. But to start with, if you look at the numbers of migrants, intra-country migrants in India, most of them, come from states like Odisha, West Bengal, Uttar Pradesh, Jharkhand, Chhattisgarh, and they come to the southern states and to the western states in search of economic opportunities because of poor disinvestment in them, owing to their sometimes caste and caste status. Many of them some of them may be indigenous people. So there's been a significant disinvestment of several decades in the development of those communities and their access to education, health, and livelihood opportunities. So that has really sort of propelled this migration to other states in search of work. Once they come to these states, again, they're devalued as human beings. We never see the human face of these migrants. They're only seen as cheap labor and assets to be exploited. And there's very little that the states where they migrate to work really do for them in terms of improving their quality of life. So it's exploitation all the way. And there's a few civil society organizations which really look at migrant health. Let me draw the your attention to a very interesting project between Tamil Nadu and Odisha. It's one of the few, interstate cooperative initiatives that looks at tuberculosis and migrant health. I mean, they have, in Tamil Nadu, they actually have a little office that deals with the health of migrants who are coming here from Odisha, who come to our state from Odisha. Not only health, it also attends to some of their other issues that are important to them. And I think this sort of attention to interstate migrant health within India, and also, of course, across borders, goes without saying, is really, really key. And COVID-19 has really brought that to the fore. The second thing that would be good to talk about, I think, is, again, harking back to Kerala. Many of the, migrants who went to the Gulf in search of work, some of them come from the caste, such as the Yarava caste and, the other lower castes who were denied economic opportunities, a chance to work and earn and live with dignity in their own state. But now they went to the Gulf and they've made good. And they've been managing to improve the developmental status of their families back home, despite the, the designated, lower caste that they came from. So, but now again, their plight is worsened. So I think when one talks about migration for work and caste in India, we can't really separate the two. Thank you for flagging that up. They suffer both at the point of origin as well as the point of destination where they go to work. So it's a double whammy for them all the way. And COVID-19 has really brought that impact out into very, very stark and tragic relief. And among them, we can add one more intersectionality, that of gender or other sexual orientations. So these intersectionalities have also become grossly exacerbated. The women have really suffered. And I didn't really want to hark back to those tragic images of a toddler trying to wake up its dead mother on the railway platform, or, a migrant, these very stark images of migrants walking, with cracked heels on beautifully paved roads that they built, or huge piles of migrants waiting at the bus stops and railway stations with no masks and no social distancing, nothing whatsoever. So I think these images will stay with us for a very long time, but as long as they remind us to have more inclusiveness of migrant-related issues in every one of our policies at the national and state levels, I think that we have to live with these images. Thanks.
Thank you, Dr. Jaya. Dilrukshi, do you want to add anything?
Yes, I think she said a lot of things that I would have wanted to say, so I'll just add a couple. It's very true that our deep divisions, they have always played a huge role in Sri Lankan journalism, and there is no way around it. Our ethnic, religious biases, our inherent ways in which that we use the mainstream media and the social media to peddle these and peddle myths. We have seen a spike in that. So first you have an infodemic. There is this surge of information. We cannot fathom what is true or what is false. So I guess there was this need for verified information. One of the good things about COVID-19 in relation to journalism, and that's something among the few positives I see, is the opportunity for people to actually seek out real information. We are really actively looking for verified, good, reliable information, because information is empowerment. We really need that kind of information. We cannot deal with information that is fake. We just need the right information. Yet there is this infodemic. One of the couple of trends I saw in peddling these stories is that there was very little understanding or the need to understand the science of it. Suddenly, everyone is a health reporter. Suddenly, everyone is chasing this big story. Your story is not just yours. It's a story for everybody. It's a global story. And that also brought out this element of, very important element of media literacy. Whether we know how to cover a health story of this nature, do we have the understanding? Do we at least have the basics? Or are we willing to learn? Are we willing to evolve? And into that not just science, about the environment, about health policies within a country and in the global frameworks that we were talking about today, and about migrant health. So there are multiple stories, multiple angles, and we seem to have not told this story. And if I look at Sri Lanka, after the tsunami happened, there was a surge of good reporting and continuous process reporting. I do actually wonder what exactly is the problem here, that we don't see that kind of inspiring, really groundbreaking stories that can tell the real story. One of our problems in battling against fake stories, fake information, is also that good ground level reporting doesn't happen. And ground level reporting is difficult in a situation where you do not have mobility. So most of us were staying at home, so we didn't have the mobility, but it doesn't deny you the connections to ground level sources, to experts, to do better research. So I saw that as a huge problem here. Talking about the fault lines, as most people would understand, Sri Lanka is quite divided along ethno-religious lines. So when infections started, when there was infections being reported, the first thing we saw was, okay, cluster infections would have a connection to a particular community, the Muslim community, because they live generally in larger communities, or there would be urban poor settlements. Obviously, in urban areas, this happens. The housing is always a problem. There is always resource stress. So the urban poor also became, COVID bombs. So you actually make comments about the poor, the most vulnerable, and then you also bring in a community element. You say that the Muslims, there were so many news reports, so much of reportage. It's incredible that we actually saw this happening. Social media is entirely a different thing, but to actually go out and say, oh, if they are there, so no wonder it's going to happen. Then happens the returning migrant workers, like that example I gave you of the Kuwait returning. Then there is a difference. Maybe they should not be coming home. Why is the government bringing them back home? This kind of command is happening. They have every right to come back home. And as much as we recognize the fact that they line our economy, the fact that they also have a right to return and to be reintegrated and to be part of our labor force, is something that we don't want to recognize. In the mainstream, not just the mainstream, collectively as a society, we have failed to mainstream these ideas of responsibility, of social integration, and of accepting everyone as equal citizens. So this hasn't happened. So among the stories that also went missing were the stories about gender, stories about vulnerable communities, identifying who needs more support, which is what accountable journalism is all about. And you didn't have the science, then you also don't also have the in-depth reporting. So we saw a cluster of, there was another cluster of problems relating to journalism. So I think at the same time, there were these shining small examples. I think we need to also go beyond the rhetorical statements of that we are actually having a crisis in our industry as well. But so how do we work around that? One, I would say that we really need to look at how we support media literacy mechanisms to support that people. Suddenly people ask me, how can I become a science reporter? Science reporting wasn't the sexiest thing to try and do in our day in newsrooms. We were also called very romantic in our journalistic approach, because you want to go into climate change, you want to report on water, you want to report on gender. I know it's a different thing for India, because some of these are really acknowledged beats, and for Bangladesh and so many other places, reporting on labor migration is a beat, but not for Sri Lanka. So therefore, you don't build expertise. So media literacy, in that sense, suddenly you have a pandemic, everyone is covering the same story. So this is our huge challenge. We need to respond to that. Second thing is about those positive stories. The one question is about literacy. The second one is about positive stories, not just to say, oh, they are doing well, and there is this other, one little group that is doing well. No, not that, but really looking at how communities are responding. One story that never really made it big in our country is how some of the religious institutions, the mosque, the temple, the Hindu temple, the church coming together, working with communities to share public health messages, to use, sharing, promoting public health messages. I think you can build unity, you can create awareness, you can also support empathy among communities and to create understanding that this is not just about you, and this is not a question of othering and discriminating, using the tools and techniques we have as journalists to further discriminate people who already are quite vulnerable. So I think we have to look at a future where journalism also evolves along with the pandemic towards setting a better example.
Okay, thank you so much, Dilrukshi. This is the last question, and just a short response. It's directed to both Patrick Duigan from IOM and also Narayan. Patrick, you and also Narayan talked about points of entry. First directed to Patrick, what should be at the point of entry in terms of infection, in terms of testing, in terms of ensuring that returning migrants are tested, and if they are tested positive, what should be done in terms of the protocol, in terms of quarantine, etc. Directed to Narayan ji is taking the example of Nepal. Okay, you have a points of entry at the Nepal-India border, but then you're talking about returning migrant workers with only one point of entry at Tribhuvan Airport. And what are the facilities there? Can Tribhuvan Airport handle such large numbers of migrants coming back? And some of those migrants have been tested positive for the virus. Patrick first, and then Narayan ji.
Okay, I'd just like to reiterate my point that I've already made, that migrants aren't a health risk and migration doesn't cause COVID. The SARS-CoV-2 virus causes COVID disease, which can be transmitted by close contact with people who also have the illness. And so in terms of where the points of entry have the capacity to handle migrant workers or other things, I mean, that's not really the question. The question is, are there systems in place to enable people to have access to the right prevention, testing, treatment, and services, regardless of where they are or what their migration status is. In terms of what needs to be in place at a point of entry, I mean, under the international health regulations, there are there's minimum core capacities that all points of entry should have, not just for COVID, but into preparedness and responding for public health events. And these include, having multi-sectoral plans in place, and contingency plans and SOPs, having training for staff, having facilities in place in terms of hygiene facilities, having isolation facilities if there is someone who is ill, like an ill traveler, and referral to hospitals within there. But in the context of COVID, we need to think beyond the point of entry and beyond borders. We need to think before people are traveling, are they having access to prevention, awareness raising, and if they are sick, do they have access to testing and treatment? In terms of what testing should be there at points of entry before, the answer is none. There is not a need to do testing, and it is not a requirement to do testing at a point of entry. The types of testing that that are available, if you're looking at the antibody testing which is available, that's not going to be useful because maybe someone has the infection but hasn't developed antibodies, or had the infection and is no longer infectious but has the antibodies. We don't yet know enough about the science of immunity. And in terms of the picking up the virus, in terms of the PCR testing, that's not at a point where that's practical to be able to do it on every single person. so this is the reason why, beyond the border, the quarantine type activities are there. And that is, again, not because migrants are dangerous and carrying disease. It's because people are coming from a place where there is different rates of transmission. And in order to, enable monitoring of their symptoms and to be able to detect who needs to be provided with testing and treatment at a later date. So I'm not sure if that answers the question, but I think we need to think, firstly, migrants aren't the disease. Migration is not the disease. The disease does not discriminate against people, whether they are, because of the document that they are carrying, because of their legal status, or because of whether they're in the country they were born or not. But the migrant does discriminate in terms of people who have access to testing and treatment, people who are able to follow physical distancing, have access to hygiene and hand washing facilities, and have access to be able to, if they are traveling, being able to follow public health recommendations about distancing, about following quarantine procedures, which is more related to preventing crowding of people rather than migrants themselves. So I think removing the sort of migration angle for it, yes, there are, when people are traveling, potentially you have lots of people gathering together, but that's the same as lots of people going to a religious monument and gathering together and traveling back to their homes, or lots of people going to a sports stadium and mixing together. So that could be creating risks in terms of people being together, but those can be mitigated by the procedures in place. And I think, but also it's important to really counter this narrative around migrants bringing disease and returnees being a risk to our communities, which we've seen, it changes, as I said, it changes rapidly depending on what the current situation is. The stigma shifts from one and one blames the other, and then it reverses, from whether it's from cities to rural areas, or from one country to another country, or then vice versa the other way. And it's really important to think about what is the science of the illness, which is transmission is based on people who have symptoms being in close contact with people who do not have symptoms, essentially.
Thank you very much, Patrick. I think that's a very good clarification to prevent stigma and discrimination of these people returning back home. On to you, Narayan.
Thank you. I think in terms of the point of entry, I totally agree with Dr. Patrick. So your question on can one single airport, 3v1 International Airport, handle such a large influx? I think there's a limitation in capacity on handling all kind of situation, like really early testing and taking them to the quarantine and transporting them from Kathmandu to their villages is going to be a huge issue. But I guess the government is trying to develop some kind of standards, facilities, and protocols around that. So there's an early, the estimation from government that more than 35,000 people in different countries in Gulf and Malaysia are in need of repatriation. So where the government is, developing a sort of standards based on a priority. So, who should bring first? Pregnant women and people with disabilities, those who have lost jobs, those who are undocumented, and those who have lost their families back home. So these things are going on, and I clearly see there's going to be a lack of use, the capacity gap. I think more than, like Patrick said, what the situation looks like at the point of entry and beyond, I think at this point, we also need to shift our narratives in terms of how we view the migrant workers, and how do we create that strong message that these returnees migrant workers are a great opportunity for nation. Of course, the pandemic pushed us back in many ways, but this is also an opportunity the returnees coming with new skills and ideas and talents can be used for economy recovery. And this is going to be a great opportunity for a country like Nepal. So we need to, I think, frame that message and put it forward and let the migrant workers feel that you're coming back home. Don't worry if you are jobless, but the country is here to support you, to give you opportunity to set up your businesses or find the right job for you based on the skills and the talents that you get in the destination countries. And I also see there's the silver line in the cloud that, these returnees migrant workers from abroad might be a catalyst in shifting political power in Nepal, as they have a long experience working abroad, having new exposures, understanding how this well-functioned economic country works, and also suffering from lack of the government accountability and human rights. So I think they're now in a better position to raise their voices, to make their local government more accountable. And I see it as, with their coming, we will have the opportunity to make our government more accountable, more open, more transparent. So I think we need to narrate a new message that, you come back and the country is there for you. The society is there for you. The private sectors are waiting because your skill is needed. And let me give you an example that when there was an earthquake 5 years ago in Nepal, why the reconstruction become delays, one of the reasons is there was a lack of labor. And where's these laborers are in Gulf and Malaysia and Korea. Now this is an opportunity. Our people are coming back, and we need to give them more opportunity and jobs, and and they become the crucial factor to build a new nation. So this is what I wanted to tell, that we need to really shift the narratives that we have now towards migrants.
I think I just want to add to that and really support that point. And I think we always, in all of the and frequently in all these webinars, talking about the risks and the negative impacts and the vulnerabilities and the challenges that migrants are facing. But we also need to think about what are the positive aspects. And yes, there's going to be significant challenges into the future, particularly for economies on returns. But also, as you mentioned, there's potential opportunities, potential people coming back, skilled workers coming back, bringing new ideas, bringing new perspectives, potentially new opportunities to really focus on rebuilding countries and rebuilding economies as well. And even thinking about, the types of capacities that exist in communities of return in terms of, even addressing situations like what to do about quarantine and things. I mean, vast networks of community health workers that many of these countries have, very strong community-based organizations which can really be mobilized to help with some of that monitoring and the opportunities that are being provided. So let's also think about, turning it on its head and what positives can come out of it.
Thank you very much, Patrick and Narayan ji. That's really, it's given the journalists who are attending this webinar a lot of ideas on how to write the stories and how to write it accurately, fairly, and to also put forward the good side of things. Everything's not negative. And I really thank our panelists, Dr. Patrick Duigan, Narayan from Accountability Lab, who's really been helpful in co-organizing this webinar, my colleague, Dr. Jaya from India, and last but not least, Dilrukshi from Sri Lanka. This webinar is great. If you look behind me, there's an address there, and we have resources. If you go down to the resources section, resources for journalists, and it's also being translated into languages, the South Asian languages that we've translated. The resources are Hindi, Urdu, and Bangla. So you can get the resources over there. And thank you so much to Ashmita for helping me organize this webinar. To all the participants here, I'll circulate the recording. There have been a couple of requests for the recordings. Yes, we will circulate the recordings to you. Just give me about a day or a day or so. Yeah. Okay. Thank you very much, and stay safe. Thank you. Bye-bye.
Thank you, Sunny.
Thank you, Sam.
Thank you, everybody. Have a great day.
Thank you, everyone.
Have a good day.
Thank you. Thank you, everyone.
Thank you.